In this video, we're going to talk about how to choose the right flexibility strut when utilizing Coyote's dynamic strut. We offer both a mini and a standard dynamic strut, which allows for optimizing the fit and function for your patient. Our standard dynamic strut is 10.5 inches by 1.5 inches, while our mini is a little bit smaller, perfectly suited for more pediatric and adult populations. This one is 8.5 inches by 1.25 inches, so slightly smaller. Both of these have multiple different flexibility levels. For our standard, we have 5 flexibility levels ranging from extra soft, soft, medium, rigid, and extra rigid. Each of these have a weight rating for each level that you really want to start there with the weight rating and pick one that is appropriate for your patient. You then want to look at the activity level. If you have someone who weighs a little bit more but is not as active, you would want to take that into consideration just as much as someone who is a little bit lower weight but higher activity. These are indicated for light to medium activity and have not been tested for running at this time. The mini strut offers the soft, medium, rigid, and extra rigid. Both of these are made out of our Resilinergy composite, which is a flexible material integrated into our composite that provides the perfect balance of both strength and flexibility. When you compare these struts to other available options on the market, you will find that these offer a lot more dynamics for your patient, so you really want to consider that when selecting the proper strut. Let's talk about patient presentation. When selecting a strut, I really like to look at what the quadricep and hamstring strengths are for a patient, as well as hip and trunk strength. If I have someone who has knee instability and a buckling type presentation or more knee hyperextension, I'm going to lean towards fitting a patient with a strut that is more stiffer in their category recommendation. This will help reduce the amount of crouch gait or buckling that can occur. On the contrary, if a patient has good quad and hamstring strength and is able to perhaps do more of a squat-like position independently, and most of their weakness is at the foot and ankle, so perhaps dorsiflexion or plantar flexion weakness, then I would select a softer strut with a little bit more flexibility that will still give them the support they need, but not inhibit the other strength that they do have that we want to maintain at the quadriceps and hamstrings. For example, if I have a patient who has spina bifida, they frequently present with more of a crouch gait. With that, I'm going to tend to use more of a stiff strut and lean more towards the rigid or extra rigid options. For an individual who might have an isolated drop foot, I would consider more of the extra soft, soft, or medium options to still allow them to engage the muscles that they do have activation in, while also supporting the weakened lower extremity. When using the mini strut, keep in mind that the soft option is very soft. So with that, we would only want to try to help support some weakness in the foot and ankle section and not be using the soft strut for an excessively crouched gait position. If you're still unsure of what strut is going to work best for your patient, don't worry, Coyote's got you covered. We offer a fitting kit for either our mini dynamic strut or our standard dynamic strut. Our fit kits are held in a really convenient portable case that allows you to easily go throughout your clinic and make the best decision-making skills for your patient. Let's take a look at what's inside. So this is our standard fitting kit, and this is going to include one of each of our flexibility levels that we offer. So there's going to be an extra soft, soft, medium, rigid, and extra rigid in this kit. There's also one of each of the parts and pieces that allow you to continue to optimize your fit and function. We have flexion and rotation shims that allow you to make post-fabrication alignment adjustments. So if you need a little bit more rotation or plantar flexion, dorsiflexion alignment changes, we do have those available, as well as additional screws, mounting plates, dummies, and padding. These kits really help to reduce the number of items that you have on your shelf. So in terms of inventory, it helps reduce improper purchasing or being unsure of exactly what strut you should purchase to best optimize the functionality for your patient. Always ensure that once you have selected the proper strut for your patient, there is Loctite and the strut is torqued to the 5 to 8 Newton meters and retorqued during patient follow-up. Choosing the right strut level helps ensure that you have great outcomes for your patient and that your patient is comfortable and is able to keep moving confidently. If you still have any questions, please reach out to us at Coyote. We'd love to help with any education, technical support, or sales support. Thanks so much for watching, and keep up to date with us at coyote.us.